Hello, once again. Welcome to my health talk show today as we keep on educating each other. So, today we want to talk about, today I want to focus much more on the boy child. So, today we want to talk about male infertility. Many times, it's all about talking about women and infertility, but less do people talk about male infertility because sometimes when a couple fails to conceive, it's always assumed that it's always, the woman who has a problem, but sometimes it's possible that it's the man that who has a problem. So basically, we want to talk about male infertility, and straight we go to the main point, or rather we define what is rather male infertility. So male infertility, it means here when a couple fails to conceive, basically uh, after 1 year of regular and unprotected sex. So if somebody, a couple does not be able to get a child within a whole year of regular and unprotected sex with no use of contraception, then we say that there is a problem of infertility. So basically, uh, male infertility basically can be caused by a number of things. Most of the time can be caused by low sperm count, that is a low sperm count production. It can also be an abnormal sperm functioning or blockage that prevents the delivery of the sperms. But as well, it can also be due to illnesses, injuries, chronic health problems, also lifestyle choices and other factors may contribute to male infertility. So those are some of the main factors that may cause male infertility. We have talked about low sperm count, abnormal sperm functioning, blockages in the urethral, that is the place or the YouTube where the sperms pass through. There could be also illness, injuries on the reproductive areas, chronic health conditions, some problems that may also affect the production of sperms. It can also be due to lifestyle choices and other factors that may contribute to this problem. So basically, we want to look at what are some of the symptoms of male infertility. So basically, male infertility here may be some of the symptoms that may happen here. It's the main symptom is actually the inability to conceive a child. So if there is a couple who's been married, as we have said from the definition, 1 year down the road, they have not been able to conceive. The spouse or the wife is not, or the partner is not using any contraception, and they're not able to get a child within a whole year, then that one becomes one of the main symptoms that there is a problem with infertility. So other symptoms that may come in some cases, the underlying problem such as inherited disorders, hormonal imbalances, dilated veins around the testicles, or a condition that blocks the passage of sperms, causing signs and symptoms that can also include the following. So problems with sexual functioning, that is one of the main things. For example, difficulty with ejaculation or small volumes of fluid ejaculated, reduced sexual desires, difficulty in maintaining an erection, that is erectile dysfunction. Pain or swelling or a lump in the testicle areas can also be one of the main symptoms. Abnormal breast growth in male, that is gynecomastia. So if somebody has a male part, female pattern kind of sex, or rather breasts, that is one of the main symptoms as well. Decreased facial or body hairs is one of the other signs that someone is having hormonal chromosomal issues. Also, another thing is a lower than normal sperm count. So if you, one of the main tests actually ask you to do is semen analysis. So if there is a decreased sperm count, is one of the main symptoms that you could be having issues with infertility. So if you have fewer than 15 million sperms per millimeter count, then you have a low sperm count. So when are you supposed to see a doctor? See a doctor if you have had if you are unable to conceive a child after a year of regular and unprotected sex. So if you have been married to your wife, she's not on any contraception, you are having regular and unprotected sex for a whole year and you're not conceiving, then you need to see a doctor. Some of the causes of male infertility we have already discussed above. What could be the main causes? So if you happen to have the above symptoms and you're not able to conceive for a whole year, then you need to see a doctor. So for somebody to fertilize, that is a male, for you to fertilize an ovum, that is a female egg, you must produce what called a healthy sperm. Initially, this involves the growth and the formation of the male reproductive organs. So that is during puberty. So at least one of your testicles must be functioning correctly, and your body must produce testosterone. Testosterone is male hormones, and other hormones to trigger and maintain sperm production. So sperms have to be carried in what we call semen. What sperm are produced in the testicles is a delicate tube transporting them from the mix with semen and ejaculated through the urethra. So there is a need to be having enough semen. So semen is where the sperm is carried. So if you don't have enough of it, sometimes it can be difficult for these sperms to be transported. So if the number of sperms in your semen, that is sperm count, is low, it decreases the odds that you to fertilize that egg. So it decreases the odds that one of your sperms will fertilize your partner's egg. A low sperm count is fewer than 15 million per millimeter of semen. Sperm must be functional and are able to move. So if it is not able to move, that is immotile, then it's difficult for it to fertilize. If the movement, that is motility or function of the sperm is abnormal, the sperm may not be able to reach or rather penetrate to your partner's egg. So if you have such kind of a problem, then you may not fertilize. So some of the medical causes of male infertility are things like we call varicocele. Varicocele is swelling of the veins that drain the testicles. So if there is a swelling, rather a swelling of these veins, it can be difficult for you to fertilize. Infections. So the infections that can interfere with sperm production can also cause this problem. This includes inflammation of the epididymis, what we call epididymitis. So if somebody has this kind of a problem, then you are not able to deliver the sperms well. Some other infections include the orchitis. Orchitis, that is inflammation of the testicles. Some sexually transmitted infections as well, including the gonorrhea, the HIV, and the likes, and some of the medical causes that can lead to infertility. Another problem is ejaculation issues. So retrograde ejaculation is one of the main conditions where sperms actually go backwards. So retrograde ejaculation is one of the things that can cause this kind of problem. So this may happen in various conditions, like including people are having spinal injuries, diabetics, people are in some medications, some surgeries of the bladder, and the prostate or the urethra. Another cause could be antibodies that attack sperms. So if you have some of the problems with antibodies that may attack the sperms, it can also lead to this kind of a problem. Tumors, some cancers or another non-malignant tumors can affect the male reproductive organs. These may include some of the pituitary gland, and others which might be unknown. So if these tumors are present, they also may affect the male infertility. Undescended testicles, this is another thing. Basically, in some males, during their fetal development, one or both testicles may fail to descend from the abdomen to the sac that normally contains the testicle, that is the scrotum. This one increases the infertility. Hormonal imbalances is one of another thing that may also happen or cause male infertility. So infertility can be a result of disorders of the testicles themselves, and abnormality affecting other hormonal systems, including the hypothalamus, pituitary, thyroid, adrenal glands, and the rest. So those ones can affect the hormones. Defects of tubules that transport sperm is another problem. Chromosomal defects is another thing that can also affect male infertility. Problems with sexual intercourse, this includes trouble keeping and maintaining an erection, that is erectile dysfunction. Some causes can also be due to celiac diseases, which is a digestive disorder caused by sensitivity to protein found in wheat, also gluten. So other causes might be due to certain medications, and also cause that kind of problem. Some surgeries, which we also mentioned above. Environmental causes, exposure to certain environmental elements such as heat, toxins, and chemicals, and also cause this kind of a problem. Industrial chemicals is another thing that is under environmental causes. Heavy metal exposures, especially lead and other metal exposures. Radiations of X-rays is another factors. Overheating on the testicles, that is about to be expose yourself to a lot of heat. It may also affect the raise. So sitting for a long period of time, wearing tight pants, that is in men, can also cause this kind of a problem. Lifestyle changes also is one of the other things, that is drug use, alcohol use, tobacco smoking, and the likes. So obesity is another thing, people are overweight, it may also cause this kind of a problem. So if you suspect that some of those conditions could be one of the things that may cause male infertility, just check with your doctor, especially gynecologist, and with your spouse. You'll be able to be given proper information on what could be the problem. So male infertility is treated where you first find what is the main cause. So once you identify the main cause, then you are able to treat it accordingly, and the problem is rectified. Towards that end, I want to say thank you for listening, thank you for watching, as we keep on educating each other. Keep on subscribing to my YouTube channel and following my Facebook page as we keep on growing together, that is in terms of health education. Thank you, and may God bless you.